Good afternoon. I am with the extraordinary CJ Robison, who has created a Rosie the Riveter moment here in Norfolk and our region with her mask force. CJ, can you tell me, well, first of all, welcome. Thank you for everything that you're doing. Tell me what this mask force is all about and how you got started.
Well, thank you so much for taking the opportunity to chat with me today, Andrea. I really appreciate it. So this started a little over a month ago with me and just a couple friends, and we really wanted to do something about the COVID-19 crisis in our area. So I'm a former nurse. My friend's husband is an ED physician, and we decided that we were just going to start making masks. And we banded a few people together, and I posted my really pitiful first attempt of a mask on Facebook or Instagram it was. And a friend of mine from the hospital I used to work at reached out and said, hey, we need about 250 masks. And back then that felt like a really big number. So we found a few more friends and we started making masks. And then through that, someone turned us on to halyard, which is a really phenomenal surgical material that can be sterilized and is really resistant to the coronavirus. And so I asked my friends at the hospital and I said, hey, do you want us to make masks out of halyard? If you give it to us, we will. And they said yes. And they gave us a ton of halyard. And that's when I posted on Facebook that I was looking for a few good people to make masks. And now we have about 1,500 volunteers. We've made almost 18,000 masks.
Wow.
We've partnered with, I don't even know, 30, 40 organizations to provide cotton and halyard masks. And it has just been just the most wonderful, challenging, fulfilling moment, I think, of my life.
Wow. That's really special. I mean, it really is. I got out sewing stuff and, a cutting board and a whatever and I was only a very small part of this, but when you initially started as a cutter, but people have gotten out their sewing machines that they had to remember how to thread a needle on their sewing machine. But it's like we could all do something and make a difference when we're all sort of sitting at home and quarantining. And have you joined forces with other mask making groups? How has that worked?
Yeah, we've joined forces with a few different teams. So probably the most significant partnership has been with mask makers. So they were making halyard masks, and they had a slightly different style than we did. That was easier to make, and we had partnered with some of the local hospitals too to test really rigorously the different styles. And so their format had a better it was just as effective as the other mask we were using, but it was more comfortable.
Is that Peggy Metter?
Yes, Peggy Meter, yes.
She's fabulous.
She is so wonderful. So she actually designed that mask, and
Wow.
it has like a neat little chin tuck underneath, and and that is just so far beyond me. And I was so grateful to encounter her and her team, and she had great tutorials, and she just shared all of that really freely with us. So we joined forces, and we were able to make, since we've joined, I should know how many of her style masks we've made, but I don't. It's in the thousands.
So I saw that the governor announced that there are going to be 3 sanitizing stations. One that's going to be in Newport News, so PPE can be sanitized and worn again. So I assume that will apply to these masks. Great.
Yes, the halyard masks are being sterilized within the hospital system. So they can be autoclaved, which is a sterilization process, and then some other hospitals are steam cleaning them, and I don't know the specifics of that. And then our cotton masks actually can be sterilized and cleaned that way too. So, and that's just a really amazing resource that the governor's putting out there for us to keep our community safe.
So, so healthcare, what beyond healthcare, what are some of the other places that have enjoyed the masks?
Yeah, so we have partnered with some of our high-risk communities, like those who are immunocompromised. So think like cancer patients or patients that have, a chronic condition that just makes them more susceptible to the coronavirus. So we've partnered with either like the Virginia Oncology Association, and we've given masks to those patients through like the Riverside Infusion Center. We've partnered with the African American Cultural Center, and I don't think I'm getting that acronym 100% right, but they have reached out to their vulnerable populations, and they are delivering 400 masks to those communities actually today. We've partnered with the city of Norfolk to make masks for essential workers and any other vulnerable populations, particularly like the homeless. We've partnered with the Virginia supportive housing group, and we gave masks to we were able to give masks to 100% of their residents, and they're an organization that helps find homes for people who are struggling to find housing. And goodness, we've helped give masks to like some of these smaller home health agencies that have that have to go into people's homes and take care of patients in their homes, which puts them at very high risk. But because they're smaller agencies, they don't have access to a lot of resources. So we've been able to partner with quite a few home health agencies. We've given masks to like 4Kids and Beth Shalom and Lake Taylor, both for the residents and for the workers as well. And we've actually, one of my favorite things that we've been able to do is my friend Rebecca Butterfield, who's brilliant. She's also a mom with 3 little kids, and she has a master's in public health and a background in virology. She designed a window mask out of the halyard so that you can actually see people's mouths while they're talking. And so originally we had prioritized the hard of hearing community for those masks, but we have since found that those are actually really valuable in the long-term care facilities as well, because quite a few of their patients struggle with dementia or are hard of hearing as well. And so it has made a huge difference for those patients to be able to see their caregivers' faces.
That's great. That's really cool. Yeah. So, okay, so where does this go? I mean, do you do this for forever? What's the next step?
That is a great question, Andrea. So we have basically divided our plan of attack into 2 phases. So phase 1 was get our healthcare workers what they needed to keep them safe. And we have accomplished that mission. We made over 11,000 halyard masks. We were able to give over 1,000 masks to all of the hospitals that we partnered with. And I never thought I would hear this in a million years, but the hospitals that we had partnered with for the halyard masks said that they had what they needed to keep their staff safe. And we were able to accomplish that before the peak, which is just phenomenal. I'm so proud of our volunteers for being able to put out.
So just to clarify then, so you all were sort of the not the stopgap, but you filled the void between when they were in a position to actually obtain the PPE and when COVID started. So you guys were there in the interim to get them to the work. And now now the supply chain is up and running. Okay, got it.
Yep, the supply chain is up and running, and the staff are able to get the masks that they needed to take care of the patients. But this next phase 2, is just as important as that phase 1, where we wanted to take care of the healthcare workers. And phase 2 is where we take care of our community. And we focus on our vulnerable populations, our essential workers that don't have the luxury of staying at home to stay safe, our high-risk population, so the immunocompromised and the homeless populations as well. And so we want to make sure that every face that needs a mask has a mask. And so we've set a goal over the next 3 weeks to make 20,000 masks. And I know that is an audacious number, but I have faith in this community that this is the group of people that can make that happen. And just to throw some numbers out there about how audacious this goal is, 20,000 masks means about 2,000 yards of cotton. It's about 40,000 cut pieces of cotton. It's 80,000 ties, which translates into about 1.6 million inches of ribbon or t-shirt material that all need to be cut. So in order to make 20,000 cotton masks, we need a lot of help. And we have had people who have been helping over the last 4 weeks, and we continue to need help. Just because that we've managed to cover the healthcare organizations does not mean that this is the moment to stop. This is the moment to continue to ramp up and to keep pushing hard so that our community is safe as well. And there really is a spot for everyone. So I think you mentioned earlier, it's been so encouraging to see sewers just come out of the woodwork. And whether, we've had some people who are teaching themselves to sew on a borrowed sewing machine. We have some people who are hand stitching these masks. We have experienced sewers that have just provided the most wonderful support for those of us who do not know how to sew. We have, kids sewing. We have third and fourth graders who have, their parents have taught them how to sew, and they're sitting there making the masks too. And so we desperately need sewers. In order to make 20,000 masks, we need people who are willing to sew them. But we also have a spot for anyone who's willing to help. All of that cotton, that 2,000 yards of cotton, it all needs to be cut. Those 1.6 million inches of ribbon or t-shirt ties, it all needs to be cut. All of those components need to be bagged and distributed to people. We need people to run the sites. We need people to help us move stuff around. And that's probably one of the things that I love most about the mask force, is that there's this realization, I think, among all of us that what we're doing is more than just making a mask and handing it to somebody. We're choosing to claim this pandemic moment, right? We're choosing to look COVID-19 in the eye and say, I'm not afraid, and I'm going to make a difference. And I'm going to use this time in my home to persevere and to change my community and to protect my community. And I love that. I love that so many thousands of people have said yes to that, and they haven't let learning how to sew or figuring out how to drive to Newport News or, figuring out how to cut 25 yards from a t-shirt intimidate them. They've had perseverance and determination, and that's exactly the sort of thing that we need in order to defeat COVID-19.
What a positive outcome from all of this. And I'm grateful that you took up the charge and you were able to motivate so many others to participate. It's such it's life-giving in this time of crisis where lives are being taken. So I really appreciate it. Now, if somebody wants to get involved, how do they, are you taking donations? How do you pay for all of this in addition to just sort of the labor? By the way, I was at my mother-in-law's last night and she gave me a bolt of fabric to bring to you. I just need to know what to do with that.
Yay!
So, from a distance, she left it on her porch, but so I need to figure out what to do with that. So tell me, I'll put the website and the Facebook page and the notes.
Yes. So we have our website, www.covid19maskforce.com, and it has a link to our Facebook page. And if you don't do Facebook, there's an email address on there, the COVID-19 sewingmaskforce.com. You email us, we will get you plugged in right away. Our Facebook page, for those of you who do Facebook, the COVID-19 Sewing Task Force for Hampton Roads is a great way to get immediately plugged in too. We have distribution days, three days a week. Let me see if I can get this right. Monday, Wednesday, and Saturday, 10 to 12, 3 to 6. You can just show up and you can grab a kit to sew or cotton to cut and turn it in the next distribution day. So that bolt of fabric that your mother-in-law so generously donated, you can just take that to a distribution site. Those locations are on our website and on Facebook as well. So you don't necessarily even need to sign up. You can just show up to help. It has been amazing to see the community support us in making these masks. So cotton costs between $2 to $4 a yard, and so we're always looking for cotton donations. We've gotten quite a few monetary donations as well, and all of that goes into buying supplies. So it costs us between 30 and 50 cents per mask to make, and so monetary donations go a really long way for that also. We have a brilliant volunteer who has figured out how to make 25 yards of ties out of a single t-shirt. So if you have new t-shirts at home, we can make a lot of ties out of that. And they're actually really easy to sew on. You don't need to turn in the edges or anything. They just roll up and they're very comfortable. We also need a ribbon and elastic. So if you have any of that stuff at home, we can use it. We can turn it into not just a mask, but a message of hope and support for the people in our community.
That's great. Well, CJ, thank you so much for spending time explaining all the great things that you're doing. I'm really grateful for the entire mask force. So go get them, to all of the men, the women, the kids, the seniors. Everybody's taken part, and so it's really cool. And I look forward to phase 2 and seeing where I can help out there as well. Take
Well,
care.
and thank you so much, Andrea. I really appreciate you, and not just the fact that you're cutting for the mask force, but that you are leading our city through this. So thank you for what you're doing for us.
Sounds good. I look forward to seeing you in person one of these days.
Yes, ma'am. I
Take care.
agree.
Bye-bye.